Hi everyone, welcome back to my YouTube channel. Today we are going to talk about anatomical planes, and here at the side you can see the diagrammatic representation of anatomical planes for the reference. So let's start our topic with introduction. Anatomical planes are essential for describing location and movements of different body parts. These imaginary surfaces help in understanding how to slice the body into consistent sections, which is especially useful in medical imaging, surgical procedures, and anatomical studies. Its types include sagittal plane, frontal plane, and transverse plane. These are the main three anatomical planes. And another plane is there that is called as oblique plane, that is also called as accessory anatomical plane. So let's talk about them one by one. First we have sagittal plane. As you can see here in the diagram, it can define as a plane that is a vertical plane that runs from front to back and divide the body into right and left portion, as you can see here in the diagram. It has two types, mid-sagittal plane, that is also called as median plane, and bisagittal plane. Mid-sagittal plane or median plane is a specific sagittal plane that runs exactly along the midline of body, creating equal right and left halves of the body. While parasagittal plane is any sagittal plane that does not run along the midline and result in unequal right and left portions. Further talking about sagittal plane, we have its anatomical importance, as this plane is crucial when describing bilateral symmetry, identifying medial versus lateral structures, and explaining movements such as flexion or extension. Talking about its medical applications, sagittal sections are commonly seen in MRI and CT scans of head, spine, and pelvis. Neurosurgeons use this plane to locate and operate on midline brain structures. Now let's talk about the next plane, that is frontal plane. It can be defined as the plane that divides the body into anterior and posterior portion, or the plane that divides the body into front and back portion. As you can see here in the diagram, it runs vertically but is oriented side to side with the sagittal plane. Now let's talk about anatomical importance of frontal plane. It helps describe features located toward the front or back of the body. Movement in this plane often involve abduction and induction, that is moving limbs away from the body or moving limbs towards the body or towards the midline. Now let's talk about medical application of frontal plane. Frontal planes are especially useful in chest radiographs like X-rays, showing the heart, lungs, and ribs. Orthopedic surgeons utilize coronal views to assess spinal curvature and joint alignment. Now let's talk about transverse plane. That is the third anatomical plane, and here at the side you can see the diagrammatic representation of transverse plane. It can define as a plane that runs horizontally across the body and divides it into superior and inferior portions, or the horizontal plane that divides the body into upper and lower parts is called as transverse plane. It is perpendicular to both sagittal and frontal plane. Talking about its anatomical importance, it is offered as a slice view of the body, allowing clear observation of cross-sectional anatomy. Movements such as rotation often occur within this plane. Talking about its medical application, transverse imaging is frequently employed in CT scan and MRIs, particularly for the brain, abdomen, and pelvis. Surgeons rely on these views for planning laparoscopic and robotic assisted procedures. Now let's talk about oblique plane, that is also called an accessory anatomical plane. It can be defined as a plane that passes through the body at an angle that does not follow the standard sagittal, frontal, or transverse orientation. Talking about its anatomical importance, oblique planes provide unique perspectives that standard planes may miss, especially for complex or curved structures. Talking about its medical application, they are indispensable in advanced radiographic techniques such as spiral CT scans. Oblique slices may be used to view joints of shoulder or hip or irregular body cavity. Now let's talk about functional relevance or functional significance of these anatomical planes. Each plane corresponds with several specific types of movements. For example, sagittal plane, it corresponds with the flexion and extension movements. Frontal plane, it corresponds with the abduction and adduction movements, and transverse plane that corresponds with the rotational movements of the body. Now let's talk about clinical significance of these anatomical planes. Clinicians rely on these planes for precision in diagnosing injuries, planning physical therapies, and conducting surgeries. For example, when describing a stab wound or a tumor location, doctor refers anatomical plane for clarity and consistency. Now let's talk about the conclusion of this lecture video. Mastering anatomical plane is more than academic. It is a vital skill for anyone entering healthcare or biology. These invisible lines bring order to the complexity of the human body, enabling clear communication and precise medical care. Whether you are studying a skeleton or guiding a scalpel, anatomical planes provide the essential map. And this was all about anatomical plane. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.